In Eastern Democratic Republic of Congo, in the province of North Kivu, fighting for territorial control has intensified since late August, triggering massive population displacement. To provide medical care to those displaced persons, Doctors Without Borders, Médecins Sans Frontières, has set up mobile clinics in the Rutshuru region, where MSF has managed a hospital since August 2005.
We set up mobile clinics following the population displacements that occurred after the military and armed violence east of Rugari. We are monitoring the population's medical nutritional status and screening for malnutrition, potential epidemics like measles, and diarrheic illnesses such as cholera.
Il est fortement déshydraté.
He's extremely dehydrated, weak, and very tired, because I don't think he's eaten or had anything to drink for some time. He also had diarrhea, so we're trying to encourage him to resume breastfeeding.
We refer patients to Rutshuru, particularly children and sometimes victims of violence. We refer them too. Here we have a child with respiratory distress resulting from an acute severe infection, a case of malnutrition.
Since late August, we've experienced a peak of violence in North Kivu, with two significant consequences. First, we have the direct consequence of the conflict. People with bullet wounds, victims of sexual violence. And then there are the indirect consequences, like the massive population displacement. What we're trying to do is to treat everything we can today. For the direct victim, we have a surgical unit in the Rutshuru Referral Hospital with ambulances that pick up the most seriously injured patients. We're also trying to treat the displaced population, the most vulnerable ones. To do so, we conduct mobile clinics and support rural health centers so that people can be treated on the spot. This also enables us to set up a referral system so we can identify the sickest among the displaced and bring them as fast as possible to the hospital.
Since January 2007, more than 6,200 patients, including 2,500 children under 5, have been admitted to the Rutshuru Hospital, where MSF provides care and handles medical and surgical emergencies. The primary illnesses are malaria, severe respiratory infections like pneumonia, as well as malnutrition, diarrhea, and obstetrical complications. More than half the patients admitted are suffering from severe malaria. This potentially fatal infectious disease, which can be treated easily, is the leading cause of death among children admitted into the pediatrics unit.
This is a case of cerebral malaria. We admitted the child here on the 27th. This malaria attacks the brain. For example, the child could become deaf and unable to speak. Those are some of the complications. If untreated, it can result in death.
MSF is also handling surgical emergencies at the Rutshuru Hospital. In October, more than 330 operations were performed. Many were obstetrical emergencies involving caesarean sections. Every month, we also treat